Ina hau e whā, tēnā koutou katoa. Good afternoon, everyone. We have an extra guest for today's briefing, Professor Sean Hendy, a physics professor from the University of Auckland, who will share some modelling that he and his team have completed on the impact that vaccinations can have on Covid-19. But first, let's come to Dr. Bloomfield for an update, then I'll come back for a very brief introduction, then we'll give Professor Hendy a chance to speak.
Thank you, Prime Minister. Kia ora koutou katoa. So today there are 15 new community cases to report, all in the Auckland region. Our total number of cases from this outbreak then goes to 1,123, and of those, pleasingly, 861 have now recovered. There are also 2 new cases in managed isolation. Of today's new community cases, most are household contacts of current cases. There are 3 who are as yet unlinked, but investigations continue, including interviews, to determine the links there. Yesterday's 1 unlinked case has now been linked to an existing case. Today there are 15 people in hospital, with 3 of those in ICU. Turning to testing now, 19,194 swabs processed across the country yesterday, and 8,370 swabs were taken across Tāmaki Makaurau, including a number amongst essential workers. And so far, over 37,000 essential workers in Auckland have been tested since the 1st of September, so thank you very much to all of those people. Our suburbs of interest, where there is intensive, including surveillance testing going on, are now changing today. Mount Eden, Massey and Papatoetoe are no longer included, but Mount Wellington has been added to that list. There are pop-up testing centres today at the Netball Centre in Ferguson Drive and the Mount Smart Stadium. There's been a great response to testing in the Clover Park suburb over the last 2 days. Another 777 swabs taken yesterday, so 10% of the population of Clover Park have been tested just in the last 2 days. 60% of Clover Park residents have already had at least 1 vaccination, and I would urge those who haven't yet had a vaccination and who are eligible to get out and do that today. In terms of crossing alert level boundaries, there's a new testing requirement for people who need to travel out of Auckland for personal reasons that comes into effect from midnight tonight. It is for most people who have to travel across the boundary one-off for personal reasons, and they need a negative COVID test within 72 hours of travelling. There are some exceptions to this, and the information is on the Ministry and Covid-19 websites. Generally, though, people travelling out of Alert Level 3, for whatever reason, regularly, for example, for permitted activities like to take care of an animal, will also need a test within the last 7 days. We're updating the information on the websites this afternoon, and we'll do an updated media release today. But what I would say is there are greater restrictions on travelling across that boundary with Auckland under Alert Level 3 this time than there were last time. It doesn't include the ability to travel to your house outside of the region, nor to travel to school outside of the region. Those were features last time. There are no exceptions for that this time. In Upper Hauraki, there's been an ongoing great response there. Every teacher and student at that school, Mātangi School, have been tested, and all but 1 have returned negative results. The other result is outstanding, not positive. Likewise, the only positive tests we've had in that rohi are from those in that single household at Whakatiwai. On the Section 70 notice that has been in place, just an update there, I'm lifting that Section 70 order for people outside Upper Hauraki that were covered by restrictions. Those restrictions applied to people who had been in that region between the 8th and 20th of September and who had departed prior to 7:30 on the 20th. There is no evidence of any spread beyond the household there, and we have reassurance from a significant level of testing in the region, as well as wastewater testing, that there is no spread. So the Section 70 notice is lifted, and those people who have been isolating, thank you very much. Stay vigilant for symptoms, but you are now released from that isolation. The Upper Hauraki region stays under Alert Level 3. We are reviewing that this afternoon, and a decision will be announced tomorrow. Thank you, Prime Minister.
Thank you, Dr. Bloomfield. Some weeks we've been talking about why vaccinations are so important. and that the more people are vaccinated, the fewer restrictions we will have to live with in the future. What does that look like in reality? Just how much of a difference does 80% of the eligible population being vaccinated make compared to, say, 90% or more? Throughout our response to COVID-19, right back from the beginning, we've always used the best research and evidence we have available to us, and we've used that to inform what we do as a government. That's included, for instance, the advice of Dr. Bloomfield and his public health team, but it's also included the work of people like Rodney Jones and Professor Hendy and his team. As part of our preparation for the future, we asked the team at Te Pūnaha Matatini, the Centre of Research Excellence in Complex Systems, to do a piece of work we could share with everyone. We received that work just yesterday, and so a few disclaimers before the work is shared. It does belong to TPM, and it is yet to be peer reviewed. It also does not represent an inevitable outcome for New Zealand. We see it as a contribution to a debate and a contribution to the work that we must do going forward. So, to take us through some of the work that we've received, I'll hand over virtually to Professor Sean Hendy.
Tēnā koutou te katoa. Kia ora, Prime Minister. Thanks for giving me an opportunity to talk this afternoon about our latest work on modelling the effects of vaccines in Aotearoa. In late June this year, we released our first major report on how vaccination could help in Aotearoa's COVID-19 response. When we started that work back in March, we were hopeful that the vaccine could take us back to that pre-pandemic world as we watched countries like the US and the UK vaccinate their ways out of very large and deadly outbreaks. However, by the time we released the report in June, we were watching the Delta variant spread around the globe. It was becoming clear that vaccination alone was not going to do the job. Our June report just reinforced this picture. Today we're updating that work to take into account several new factors, however. The first is that we are on track to vaccinate upwards of 80% of those aged over 12. That's fantastic. For those over 65, the proportion of people with at least one dose is now up over 90%. The rate of uptake suggests that we could aim really high, approaching well over 90% in coming months. And the second new piece of information is that Pfizer has announced that the vaccine may soon be available and approved for use in children over 5. So this means that it might be possible to achieve vaccine coverage right across the population of more than 90%. And these aren't scenarios that we dwelt on in our June report. So today's report is to address this and update things. Now, I do need to emphasise that this is just a modelling study, and although we've tried to incorporate the best data from overseas, there's still many uncertainties. If new information does come to light, new information from overseas, our conclusions would have to be updated to allow for that. So with that said, what does the model tell us about life with vaccination coverage in the 90s? Well, the best outcome would be what is called population immunity. This is where enough people are vaccinated that the virus simply can't find any new people to infect. So outbreaks fizzle out on their own. This corresponds to keeping the effective reproductive number of the virus, that number R, that modellers like to talk about, below 1. And if we could achieve that, then the effects of COVID-19 would be greatly blunted. The modelling tells us that because Delta is so transmissible, population immunity is probably still out of reach by vaccination alone. However, that R number depends on other things, including other public health measures that we might put in place. So we looked at what would happen if we were to use a suite of moderate, sustainable public health measures, such as some combination of masks, better ventilation, rapid tests, vaccine certificates, for example, rather than our current approach that's very much based around lockdowns. We found that there are scenarios where population immunity is achievable, provided we get high vaccine coverage, and this is supported by these moderate public health measures, as well as effective contact tracing. There'd be a lot of benefits to achieving this. For example, if we were to get to 90% plus vaccine coverage and those over the age of 5, those moderate public health measures could reduce the health burden to something that's less than that of seasonal influenza, with only moderate border restrictions in place. Nonetheless, there are still scenarios where, despite a high vaccination coverage, population immunity would not be achieved. Now, this would likely result in severe health burdens that are order of magnitude worse than seasonal influenza. For example, if we only get to 80% of those over 5, then we could still experience 60,000 hospitalisations from COVID-19 in a one-year period and 7,000 fatalities. Our healthcare system couldn't cope with this level of illness. We would need to continue to use lockdowns. The message from the modelling is that COVID-19 is going to continue to disrupt our lives for some time yet, but that we can minimise that disruption by ensuring we all get vaccinated. There's no magic threshold for vaccination coverage, just the fact that the higher the coverage, the less restrictions we will need in coming years. The report today, clearly demonstrates this trade-off. There are important updates to the work we've released today that we're working on at the moment. These are going to be released in the coming weeks and months, and these include a more detailed look at exactly what these measures might look like and how they might work best in the community and at the border. So I'll just finish by just thanking my co-authors on this report, Mike Plank and Nick Stein, as well as the rest of the Te Puna Matatini team who are working on broader aspects of our COVID-19 program. And finally, let me just stress the need that we need every community to be well covered by vaccination. For life to go back to normal, we really can't leave anyone behind. Kia ora.
Thanks, Professor Hendy. As you can see, sitting behind the work completed by TPM are complex models. A lot of variation to them and likely to be changes to them in the future. They've had to take into account a huge range of variables, and I expect those will be debated. But there are still some really strong themes that we can take away, even at this early point. The first is that vaccinations matter the most, and that they are cause for hope. In the beginning of our battle against COVID-19, we used lockdowns because none of us could risk being exposed to the virus. To control it, we couldn't just isolate away those who had the virus. We essentially had to isolate away everyone. With vaccines, we can turn that model on its head. We can isolate those who have COVID rather than everyone, because we have the individual armour of a vaccine. That means if we do come in contact with the virus, we're far less likely to get seriously unwell, to pass it on, and then to cause a major outbreak. The second important take-home is that vaccines alone aren't enough. If you just use vaccines and nothing else, and there is an outbreak in New Zealand, it could still lead to quite widespread outbreaks and hospitalisations. Now, that may not have been the case with other variants of COVID, but unfortunately, Delta is more transmissible. If there is an unvaccinated person, it is very good at finding that person eventually, and then the next one, and then the next one, until it's quickly found a lot of people and potentially overwhelmed the health system. Now, if you're someone who has been vaccinated, you might think that doesn't matter, but it does. Children can't be vaccinated. It will reach them, and we've seen it reach them in this outbreak. And also, if our health systems are overwhelmed, we all suffer. However, that doesn't mean the public health tools we have to use alongside them need to be as disruptive as the ones we've had to use till now. They could, for instance, be measures, as has been referred to in this work, as sustainable, a mixture of things like isolating cases, improved ventilation in public spaces, strategic use of masks, vaccine certificates, and an approach at our border that means we try and catch cases, but won't necessarily mean that full 14 days of quarantine as we know it now. But the way we have to use these again will come very much down to how many people we vaccinate. The third point, and the one I know people will be looking for, is whether these tools have to include lockdowns. What we can see is that essentially at very high levels of vaccine, we can take level 4 out of the toolbox and instead set it aside while vaccines continue to be as effective against variants as they have been to date. And I know people will see that as very good news. Again though, it all comes down to vaccination. As we've said right from the start of our vaccination campaign, the more New Zealanders who get vaccinated, the more opportunities open up to us and the more freedoms we gain. They mean we don't have to live with COVID. In fact, we can stick with the plan we talked about right at the beginning of this pandemic, which wasn't 0 cases, but 0 tolerance for COVID. We can vaccinate, we can isolate, we can control it, and there is reason for optimism. I wanted to finish by sharing what comes next. Last week I mentioned that our alert level system needed to factor in the new tool that is vaccinations. We've been undertaking work on this and we'll look to share that work when it is complete in the coming weeks. That means before we have the vast majority of New Zealand fully vaccinated, you'll be able to see what a difference those vaccines will make to the way that we respond to an outbreak in the future. We increasingly have the research and evidence to underpin that work, a range of different sets of modelling, advice from our public health team at the Ministry of Health, and we have a set of principles that we are working to. I wanted to share those principles with you now. The first, as we undertake our future work on a vaccine framework, includes vaccinate. That means good coverage across geographic areas, age range, and ethnicity to prevent outbreaks. Aggressively isolate cases when they do arise. Control the impact of potential cases through sustainable public health measures. Give as much certainty and stability as possible for people and businesses. Catch cases at the border, but work towards removing the bottlenecks. And ensuring our hospitals and public health system are well equipped to care for cases if and when they do arise. I look forward to sharing that work soon as we look towards the future, including this summer, with a sense of optimism. For now, I want to say thank you again to all New Zealanders. Your work has meant that we have had one of the lowest mortality rates and hospitalisation rates from COVID in the world. Your hard work has meant that over the last 18 months, we've had more days without restrictions than almost any other country with COVID. It's also meant that our economy has recovered to see activity back at pre-COVID levels, with unemployment among the lowest in the OECD. And there is now an opportunity for us all to grasp, to be one of the most vaccinated countries in the world. The progress in recent weeks has been significant. Auckland is at 80% first doses for the eligible population. 90% is within its sights. Now we need to work together to see all our communities get up to those rates and beyond. It's not the Aotearoa way to leave anyone behind, and it just doesn't feel right. So here is our chance to lead the world again, and that comes down to each and every one of us. We have the supply of vaccines we need. We have the workforce ready to do the job. So have that conversation with your whānau or friends. Help someone make a booking or give them a lift to a vaccination centre. Each action, large or small, gets us a step closer to the opportunities and freedoms we all want. In the meantime, across all the debate you'll see amongst modellers and researchers, there remains one simple message: get vaccinated. It's the reason we should all feel hopeful.